Hi, it's David from Bodyworks again. So today we're talking about the rotator cuff. The rotator cuff is a set of four muscles: supraspinatus, infraspinatus, teres minor, and subscapularis, that all control the rotation of the humerus in the socket connected to the scapula. If you're finding clients have a lot of winged shoulders or lifted shoulders, or the shoulder girdle, which is the movement of the scapula around the ribcage, seems to be restricted, frozen, or misaligned, oftentimes it's actually going to be connected to a restriction in the shoulder joint, which is that ball and socket joint, and definitely affected by restrictions in the rotator cuff. So working on these four muscles and getting them to move better will allow the shoulder joint to do what the shoulder joint needs to do, and the shoulder girdle to do what the shoulder girdle needs to do, and often will be the thing that's missing from your work that's going to allow that shoulder blade to slide down the back and rest more easily on the back of the ribs as opposed to being stuck up here. So let's get to it. Okay, so we're going to undrape the client in prone, hang their arms off the table, and keep in mind that rotator cuff, all four muscles, you've got supraspinatus on the top spine of the scapula. Infraspinatus is all of the back of that entire bone. Teres minor is all along the lateral edge, and then subscapularis is the entire front anterior portion of the scapula, between the scapula and the rib cage. And so you can do a lot of great things just making sure you hit all four of those muscles. But keep in mind their jobs are rotation of the humerus in the scapula. And so supraspinatus, infraspinatus, and teres minor all externally rotate, and subscapularis underneath internally rotates. So we'll start with just simple myofascial release on these, and then we'll add in having some passive movement where the therapist creates those movements, and then we'll add in some active movement where the client creates those movements. So first, we'll just start with some very simple myofascial release. I'll start with infra. I'm going to use a soft fist right in the belly of the muscle. And I'm grounding through my feet, and I'm just gonna let that muscle melt under there. And you can think of it as almost two halves. There's a lower half and an upper half. I did the upper half, now I'm gonna do the lower half. Great. And now, coming in here, I can put my thumb right between the scapula and the collarbone and get supraspinatus. And I'm going to contact it and just drag slowly towards the head. Certainly isn't the only way to get at this muscle, but it's an easy one. And then last but not least, I can come up the lateral edge of the scapula here and work on teres minor. Now we can get at subscapularis from prone. I personally like to do it supine more, and we'll show that a little bit later. But if I want to get it from prone, I want to be thinking about coming up into the front of the scapula. So you're going to need to make sure that the scapula is away from the ribs, and then you can come up into it here, which probably doesn't feel all that great. How does that feel, Mary?
I kind of like it.
You kind of like it? Hey, some people do, some people don't. All right, so that is a little harder to do like a full myofascial stroke on, and you do have to watch out for the brachial plexus nerve. That's just myofascial release. Next, we're going to add in some passive movement. So I'm going to grab a stool. And using largely the same contacts, I'm going to contact the muscle and myself rotate the humerus in and out of the socket nice and easy as I'm doing release on the muscle belly. I can do that up here. I can do that down here. As long as I'm getting this spin and rotation of the upper arm and not just rolling the forearm. I can come in here, switch thumbs, and also get supraspinatus. And I'm using what I like to call, and there's another video where I talk about this, good cop, bad cop. This is fairly deep, not super deep, but 5 to 7 on the intensity scale. This is super light contact. And last but not least, again, work on Teres minor, all while doing a little bit of passive rotation. And here, because we're not able to really get subscap and slide along it safely, we can really just contact it, is where adding in that passive movement can really make a big difference over just contacting it. Nice. And as with any good myofascial work, you can start to see a little bit of redness pop up where I'm working. All right, so that's passive version with me moving the client's arm and essentially pin and stretching the muscle in place. The next thing we're going to try and do is have the client themselves do the same thing that I was doing, but now she's actually doing it herself. And so as I'm coming down through your infraspinatus, I would like you to do that movement, Mary. There you go. And I should feel her muscle tighten and release under my hand. Nice. You'll see me using a lot of soft fist and thumb right now, but the tool doesn't matter that much. I could easily be using a light elbow point in here. Or what I think of as light. How does that feel, Mary?
I feel it.
You feel it?
Yeah.
Yeah. All right, and so again, the same contact. Here's supraspinatus. I'm gonna have the client actively move their arm in and out in rotation. And again, I should feel the muscle bunch and release, bunch and release. Her breathing picked up a little bit because it became a little bit more intense. Mm-hmm. But we're also training her brain to really clock how that movement's supposed to work versus how she might normally do it. And last but not least, coming up and under for subscap. Go ahead. Ah, yeah. Oof. Yeah. And let it go. Nice. And notice, I didn't really work on where her scapula was placed on the rib cage, but as all of those loosened up, her scapula allowed me to move it much more easily down and into more of a neutral position, and it's got more ability to slide around the rib cage. Mary, since we're still recording, what do you notice in terms of the difference between the two shoulders right now?
Oh, I feel a pretty big difference. This side, the side that you worked on, feels almost like much more relaxed, like buttery sensation compared to this other side.
Nice. All right, I should probably balance her out just a little bit, you know, which doesn't mean you always have to do the same thing to both sides. In fact, one of my sayings is asymmetrical bodies need asymmetrical treatments. So if somebody has one shoulder that's noticeably winged compared to the other, you might just do one shoulder. She's pretty even from left to right, so I might as well balance her out just a little bit. And I'm sitting to do a lot of this, but I could easily just be kneeling if I don't have easy ability to roll around the table if you're in a smaller room. Nice. So we did show how to release subscapularis in prone, but I actually prefer to do it in supine for a few reasons. One, it is a very sensitive muscle. So if I'm contacting it already, I want to be able to see her facial expressions, see her breathing, see if she's resisting, see if her face scrunches up, because that gives me a much better indication of how much or little pressure I should be using on this very sensitive muscle. Again, I can contact it prone, but I'm not getting all of that information unless I'm really talking to the client and checking in with them. Here, I've got easy access to the subscapularis, and I can track what's going on for her with more information than just her telling me and just checking in on pressure. So I'm going to pull the arm up. I'm going to do a few things to find the right placement of the shoulder to make this very easy. And when I'm moving somebody's limbs around, I don't want to grab if I can. I want to rest their limb on my open palm and just allow it to move in gravity, because that's going to be much easier for her to not resist. So my goal here is to move the arm ever so slightly out. I'm going to take this other hand and scoop under her scapula and try to slide it back and down from underneath. That's going to bring the lateral edge of her scapula out and down and give me much easier access with my thumb. So now, with this resting on this arm, in the crook of my elbow, I've got this thumb able to find the very anterior portion of her scapula. And obviously with draping wise, it's hard to see exactly with this camera, but here's the lateral edge of her scapula. I want to make sure I'm up on the front of the bone, and I can feel the muscle right there, which is already probably doesn't feel all that great, right?
It's not too bad, actually.
Cool. And that's good. You don't want to make it bad. Right now, in order for her to start to learn to fire it, I can ask her to rotate her wrist into my forearm to engage subscaps. So that's out, and I want you to think about that direction towards your hip there.
Oh, yeah.
And let go, and let go, right? And so that's firing subscap very immediately. So I can hold a trigger point on it, have her fire nice and easy, and then let go. And then slide the scapula down more. I just want to make sure that I'm not going too far medial underneath, because you'll start to get close to the brachial plexus. You want to make sure that you're not pressing right on that, because that'll make her whole arm go numb. All right, one last time. Press in and release. Nice. Good. So that's a trigger point and PNF style release. Last but not least, we can actually do a nice PNF style release of the subscap to finish. And this is just a really nice way, after all the deeper work on there, to help it release and help it relax. So first, I'm just gonna check, right? I've got the crook of her elbow in my fingertips here so that I can draw her shoulder blade down into neutral and her humerus as parallel to her body as I can make it. And you can see here that She's really not resting comfortably at 90 degrees. There is some subscap limitation, right? With some people, if they were very, very open, this would be parallel to the table. I've had a lot of clients with major injuries that can't get past here after, let's say, a shoulder replacement. But this is medium. It's definitely a little restricted, but it's not too bad. Now, to help it open up, I want to remind her that to fire subscap, you're going to do that. And I'm going to keep this traction down here. I'm going to place this hand on top of her hand very lightly. I'm just going to ask you, fire subscap to bring your palm, right? And resist it, count 5, 4, 3, 2, 1, and let go. And I don't want to just shove down as she lets go. I actually want to see if her brain will slowly but surely release the muscle down. And this is very, very light here. All right, one more time. Fire 5, 4, 3, 2, 1, and release. Aha, now it's starting to let go a little bit. And fire again. 5, 4, 3, 2, 1, let go. There it goes. You feel that? Mm-hmm. Last time. 5, 4, 3, 2, 1, and release. Nice. All right, and so we started with her roughly there. We've definitely gotten 5 to 8 degrees more openness in the muscle, and that's an improvement, right? Is it parallel to the table? No, but I don't need to go over and over and over trying to get perfection. I'm just trying to get some improvement. And last but not least, I can just sort of shake it out and place it. Cool. From a draping perspective, especially on women, I want to make sure that the breasts are covered, so I can take this sheet and tuck it under there and still have room to get at subscap. And now I can draw this down, rest that on the crook of my elbow, and scoop the shoulder blade under to expose the lateral edge. So now I have this thumb free to come in contact the anterior face of the scapula. Ooh, hi there.
This side.
Dang, what did you do to this one?
I don't know.
All right, so we're both saying dang because I'm feeling a very, very giant taut section of this muscle. All right, so now I'm gonna just hold that tight area and have her contract subscap by pressing down into my forearm and letting go. Ooh, hi there. And let go. Nice. Ooh. And again. Ooh, wow. And let go. Yikes. Did anything tweak a nerve there?
No, but
good.
I feel it.
All right, now we're gonna just repeat that nice PNF style stretch. And on this side, you can really see that she's even a little tighter, and this doesn't hang quite as low. There's also some forearm fascial restriction up through there that's pulling this a little bit into rotation, but that's fine. So now, with this light traction here, just keeping the shoulder blade tucked under and the humerus against the side of the body, I'm gonna have her fire for a count. Go ahead and 5, 4, 3, 2, 1, and release. And again, 5, 4, 3, 2, 1. Ooh, something just popped. Was that a good pop or a bad pop?
Good.
Good.
Yeah.
Good pops are good, bad pops are bad. All right, 5, 4, 3, 2, 1, release. And last one, 5, 4, 3, 2, 1. Good. And now you can really see, you know, we started with her about there. She's definitely improved maybe 10 to 12 degrees. We did get a little pop, and that to me is the actual humerus ball fitting more cleanly in the socket, which is great as long as it doesn't hurt. And that is a good improvement. And we can shake it out. And if you roll your shoulders around a little bit just to feel what they feel like, they should feel different and in a good way.
A little more free, yeah.
Cool.
Definitely freer.
Nice. So those are some very easy to learn rotator cuff techniques that are simple, that can easily improve your results with shoulder pain clients, with neck pain clients. If you want to learn some much more advanced techniques about the entire shoulder, we have a great 2-day live workshop here at our classroom space in New York City. We offer it about twice a year. It's worth 12 credits for New York State and any state that takes credits from NCBTMB, which at least 37 states do. That class you can check out in the links below and sign up if you want, and any of our live courses are offered there. And if you found this video to be valuable, we think you'll find this video to be valuable too.